We are talking about low testosterone levels. They're often overlooked, but there are a wide range of benefits of supplementation. And joining me now is Dr. Russell Bartels from Vitality Bioidentical Hormones. It's good to see you, Dr. Bartels.
Good to see you again.
Thanks for joining us.
Thank you.
We want to focus in on testosterone specifically. Do you find that a lot of your female patients don't realize they need testosterone, or is it both, men
Absolutely.
and women?
I mean, as an OBGYN, that's, my practice is primarily women, and we started using the bioidentical hormones for treatment of menopausal symptoms. And, many women are familiar with estrogen,
right,
and progesterone, but they're surprised sometimes to hear about testosterone being a vital component of making them feel better. And in the past on these segments, we've talked about bioidentical hormones being a safer, more effective method compared to synthetic hormones for menopausal women. We've talked about how we find great symptom relief for men using testosterone, bioidentical testosterone supplementation. And it's a matter of realizing that you need it, and a lot of people just think this is how aging goes, and this is how I have to live my life. But we are making big changes in people's lives. But today, I kind of want to focus the emphasis of bioidentical hormones, specifically testosterone, in the treatment of chronic illness such as fibromyalgia, say arthritic conditions.
Wow.
And fibromyalgia is one of these conditions that's almost we don't know what's wrong with you, let's just call it fibromyalgia. And it's frustrating for patients because they're put on numerous medications, some for nerve pain, some for body aches, some for depression, which could come from being uncomfortable and in pain all the time.
Right, they're taking a lot of medications throughout the day.
But no one really knows what's wrong with them. And there's great data out there, and I'm seeing it, going from data to reality in treating patients with testosterone who suffer from these chronic conditions. And I've known about it for years, but and I've seen patients for years as a OBGYN who say, I have fibromyalgia, but I never thought it was in my domain to treat. I said, okay, you're on all these medications, it's not my responsibility, but then I've been treating them with the hormones maybe for another condition, and they're saying to me, is it possible that, I'm feeling less aches and pains and my mood is improving and I'm sleeping better? Is my fibromyalgia getting better because of the testosterone? And in fact, and I'm happy to tell them, I think it is, and I've learned a lot more about it over the years, and there's great data and research that supports this, and I'm now seeing it in my patients.
So are they actually weaning off some of that medication that they were taking before they're feeling better?
They're surprised. They've been on antidepressant medications for years, and sometimes for depression, sometimes even those same medications for the aches and pains, but a whole list of medications that they're slowly weaning off. It's not an instant fix, but when I see these patients back, a month, 4 to 5 weeks after their initial dose, and they're saying, is it possible, I can move better? Is it possible that I can get to the gym now? Is it possible I just don't hurt when I wake up because of this?
I understand.
And it's just fantastic.
What are some of the contraindications?
Contraindications. Yeah. There really aren't that many contraindications to testosterone therapy at all. I mean, we use it almost in anybody. There are some patients who might be on some medications like Coumadin and anti-clotting, or medications like that. We have to be careful, but there's not that many contraindications. And so I really am, appealing to those patients out there listening today that if they've been suffering from these chronic aches and pain type disorders that no one can really put their finger on, or even if they've been told, well, this is what it is, there's a strong chance that they're going to just feel better if we get them on testosterone therapy.
Yeah, absolutely. So definitely, check into that. Have your levels checked. You'll probably be surprised to see how low your testosterone levels are. So
yes, and it's also important to point out that you could have some normal, especially for the women, normal testosterone levels. And so if you get those checked somewhere else and they tell you it's normal, you know what, come in and talk to me about it, because we don't want it just in that kind of artificially determined reference range. We want it to be above and beyond that. So, and that goes for men as well. If if you're told, well, it's normal, we could do better most likely.
All right. Thanks, Dr. Bartels. Good information. So if you want more about Vitality Bioidentical Hormones, super easy. You can go to vitalityhormones.com, or you can always call the number you see right there on your screen.